Hi, how's everyone doing today? My name is Dr. Ayo with Legacy Clinic of Chiropractic in the Villages, and we will be discussing the Decompression Therapy Program. The reason that you're here today as far as doing the Decompression Therapy Program is you may have one or several of the different conditions here. Disc degenerative disease, you may have spinal stenosis, or maybe you're suffering from a disc bulge or disc herniation. When it comes to the job of decompression therapy, we're working on the structure of the entire spine here. So what's happened to your spine over time is with that degeneration or herniation or stenosis, any of those things could have caused this to occur, and now your condition is chronic. So we want to get you out of chronic pain, but not just out of the pain, we want to fix the structure and the curvature of your spine. So typically, you actually want to have an S-shaped curvature in your lumbar spine or your cervical spine in your neck as well. Now let's take a look at this picture here. We have an image of what would be considered a spine that needs a lot of work done, that has a lot of degeneration. And as you can tell, not only do you have disc issues, arthritic changes, degeneration changes, but you also have a degree of curvature that is very limited. Now this is an example of a good spine. So if you take a look at this x-ray, you can see a grand difference in the degree of curvature. You see a nice S-shaped curvature, great spacing in between each bone, each disc. It shows you that that patient has a very healthy spine. This is what we're working on over time with you. With the job of decompression, what's happening is that we open up the joints, so where the discs are being compressed, there's gel that leaks out of those discs when the compression occurs. And so that starts to put pressure on the spinal cord or the nerve roots. So in turn with decompression, it's like an accordion, I always explain it, is where we open up the joints with that decompression table. It's an increment of weight that's pulling on the joints to allow the hydration and gel of that disc that's leaking to seep back into the area that it's supposed to, so that it puts less pressure on those nerve roots and it puts less pressure on the spinal cord. And so over time, as we complete the decompression therapy, that's putting less pressure there, which in turn should decrease your pain, decrease your symptoms. You should be able to move a whole lot better, and you should be able to have a better, healthy lifestyle.